The community are in awe of the service that they get from the mobile surgical unit, and really thankful that they come and do lists and that they get seen and in a timely fashion and out the other end. Very happy.
We've got a really bad rate with our childhood teeth. It's awful, so that's a huge thing because we're getting a lot of kids that wouldn't make the trip to Palmerston or wouldn't even go to the dentist if they weren't forced. I mean, it's quite incredible, but even just the day stuff, like the screening with the scopes and things like that, it's huge.
Huge waiting lists for Dunedin Hospital or going private, so it's a brilliant service because they can come in and have their minor procedures done a lot quicker.
I don't think a lot of these kids would get treatment if they had to go to Palmerston North to get it, and they certainly won't get it in the dental clinic because it's quite extensive treatment that they need. So if they...
No, I do encourage people to fill out the how are we doing forms so you get feedback, and I don't think I've ever had negative feedback. People have been really happy.
We don't get the names of the people till the morning of, which is a wee bit frustrating. We'd actually like to sort that. That was changed recently because I said I didn't like the names going in our open lockers there was no privacy with it. So
I really enjoy it. My background before I started working at Dannevirke was surgical, so it's just great. Like I've sort of relived my life again on that, and so it's great to be able to keep your hand in that side of it because what we do in Dannevirke is quite different now. Like we do a lot of medical and the health of the older person and things, so to have that surgical day, I love it. Yeah, it's really good.
And so last of all, what brings you all to Wellington?
Like I've learned a few things that we actually need to be doing in our practice up north that we're not doing. So that was to do with sedating patients and etc. and monitoring etc. So yeah, you do pick up things when you're coming up here, when you come down here.
Oh, at the Nurses Symposium, which is a fantastic outing in Wellington, with interesting topics put together. Yeah, and a great place to get together with other registered nurses from the top of the island to the bottom. Fantastic.
A lot of it's the networking. It's really, like, I find it so helpful to be able to talking to other people in the same situation and in different situations and seeing what those nurses do and how they operate. And Dannevirke's quite unique with some of the things we do because most of the small rural hospitals are still DHB led and funded, and we're not. We're actually considered a private and we're GP operated and led, so it's quite interesting hearing their side and them hearing ours.
The speakers are always interesting, motivating towards study a lot, which I need. I need motivating, but I always leave the conference ready to do some more study.
The four of us that work on the bus are all here, so that's great for us. And for me personally, to come to the first conference and put faces to names and meet other people that go on the bus, it's brilliant. And I think what struck me is the anaesthetic techs. You know, some of them are enrolled nurses, and I've always been a great fan of enrolled nurses and their role that they play, and it's awesome to see them in this position.
Having the speakers go around all the tables and stuff with just quick, succinct education about different things, that was really good. Yeah.